We learned this week the Trump administration is set to shut down the national LGBTQ+ youth suicide lifeline. Tonight, we are digging deeper into the move, which one Minnesota advocacy group says will put more young lives at risk. The specialized option for LGBTQ+ support was offered soon after the launch of the national 988 lifeline back in 2022. The option prompts callers to press 3 to connect callers with trained counselors. The Department of Health and Human Services is reporting that option will end on July 17th as a budget savings measure. 2024 federal funding for the Press 3 services was $33 million. According to federal data, more than 14.5 million people have contacted the 988 lifeline over 3 years' time. Nearly 1.3 million calls or texts were routed to the LGBTQ+ line. That's nearly 9% of all contacts made. In response to the service change, the executive director of the Council on LGBTQIA2S+ Minnesotans telling KTTC in part, quote, "This is a callous and short-sighted decision that removes evidence-based life-saving care for a high-risk population of children and young adults, many of whom press 3 because they have nowhere else to turn," end quote. Research does show LGBTQ+ young people are more than 4 times as likely to attempt suicide than their peers. The Substance Abuse and Mental Health Services Administration, which oversees the 988 program, released a statement about the change, saying in part, quote, "Everyone who contacts the 988 lifeline will continue to receive access to skilled, caring, culturally competent crisis counselors who can help with suicidal, substance abuse, or mental health crises, or any other kind of emotional distress," end quote. NAMI, the National Alliance on Mental Illness, says this isn't one-size-fits-all care, stating it's built specifically for our LGBTQ+ youth. A spokesperson for the White House's Office of Management and Budget is quoted saying the proposed budget wouldn't grant taxpayer money to a chat service where children are encouraged to embrace radical gender ideology by counselors without consent or knowledge of their parents.